We're talking Egypt's success in treating hepatitis C, which is more like a lighthouse, actually, for the rest of the whole world. The total healthcare services provided through the different presidential initiatives, not only the 100 million health initiative amounted to more than 145 million services benefiting 90 million citizens. So as we can see the figures, Dr. Anan, how it reflects on the health services provided, the health insurance, the health care provided to the citizens. We have also the decent life initiatives and the quality of life that is provided for Egyptians. How can we support our brothers and sisters in the rural areas and support their health as well?
That's a very good point and a very good question, and I will add to it what you mentioned as well for sustainability, which is the most important factor in healthcare. We can launch a lot of initiatives, but if we cannot sustain health providing, it's not going to be a success. And what you mentioned is exactly what was reflected in Egypt Vision 2030 for Sustainable Development Goals for Health, which is to transform the healthcare system in Egypt from being a system-centric care to be a citizen-centric care. So instead of just focusing on having hospitals, beds, we are focusing on having just a structure, data, and governance. No, we need to have a good system that's integrated to promote health, not just to treat diseases. And hence, we do have a lot of presidential initiatives. The presidential initiative was actually launched to have an integrated patient journey and a citizen journey from birth till senior citizen level that we are treating and promoting health. And it's very important to differentiate between promoting health and treating. For example, smoking cessation campaigns, obesity campaigns, it's not a disease. We are promoting health, trying to make sure that disease won't happen, complications won't happen. So we do have presidential initiative from mother and fetus presidential initiative. We do have then for school age, a lot of presidential initiative for school age, school feeding campaign. We do have obesity stunting short stature campaign. We have anemia campaign, diabetes type 1. And then we do have for youth, premarital screening. We do have then for all chronic diseases, chronic hepatitis, ending up to cancer initiatives. And for cancer initiative, for example, just to mention one example, we were discussing chronic hepatitis and hepatitis C. However, we do have a lot of patients that will actually develop liver cancer, unfortunately. So Egypt as well, and Dr. Khaled Abdel-Ghaffar, the Minister of Health, launched liver cancer presidential initiative, which that to follow up all the 59 million citizens screened by chronic hepatitis for liver cancer, which is hepatocellular carcinoma. Just yesterday, they launched the first phase of results, and Egypt screened 115,000 citizens were suffering from chronic hepatitis for liver cancer. The identified cases were identified earlier. So when you identify an early cancer case, you are saving life because it will be curable, treatable, and you are saving millions because treating an advanced state of cancer, it costs millions of millions. Instead, if it's just an early state, you can cure, saving his life. And what you started our episode with a good quality of life as well.
Yes, definitely, because all those initiatives mainly have this important and noble goal, which is to transform lives of Egyptian citizens, to build the Egyptian character. So as we can see that the president is directing the government and the whole team on building new Egypt, the new republic, and one of the main components of the new republic is to focus on the human being. So that's why we are serving the human being on more than one dimension. The health is a very important dimension, definitely. We're talking, Dr. Anan, also about the electronic platform and the increasing of the annual growth rate of the Egyptian medical tourism market. This is, again, another dimension. And here, as we Nile TV International, as an international channel, how can we attract visitors who come for tourism in Egypt also to benefit from health services?
It's a great point. For medical tourism, and in Egypt, for example, we do have high specialty and expertise in certain diseases. For example, for liver diseases, we're talking chronic hepatitis, we're talking hepatitis A and B and C, we're talking about liver cancer. So in terms of even treatment costs, if we're calculating per patient or per capita, as we say, treatment in UK for one case of chronic hepatitis, it will be exactly 15 times treating one case in Egypt, if we're talking with USD exchange rate. So it will be even the cheaper in terms of money. We do have the expertise. No country treated as much patient like us in chronic hepatitis C. And as well as if we're talking tourism, they can actually watch Nile TV all day to see how they will enjoy the tourism part. They can run it through the government itself. And we do have the medical tourism program, which is already up and running, especially if we're talking about chronic hepatitis. If we are talking about, for example, cancer patients, if we're talking about chronic hepatitis, for obesity management, if we're talking plastic surgery, you can see that every year the number of medical tourism is expanding significantly every year. People from the Gulf area are coming from Yemen, from Syria as well. They're coming for tourism. We're talking about Europe. We have a lot of English citizens coming for medical tourism. The number one aspect for medical tourism is care, taking care of the individuals, the human himself, in terms of treatment, and because it's medical tourism, in terms of leisure as well, how to make a good program for them. They can easily direct to the website of the Ministry of Health. They will find a program for medical tourism where they can apply.
Yes, great. And taking care actually is the key word. It's the magic word in the health sector, how to take good care of the citizens. How are we also working internationally in sense of partnership with insurance companies around the world?
Okay, so we are moving from what we are calling a national health service with a single payer, like the MOH, to a different universal health insurance organization, what we are calling the UHIA. So we launched a new insurance system in 2018. So we are actually moving all the health insurance organization on a state fund organization, which we call على نفقة الدولة. So all these insurance body will be faded till 2032, and by 2032 you will have a brand new insurance system. It's based exactly like the insurance system in Canada, where you do have a separation between the provider, the service provider, which is what we call in Egypt the Egyptian Health Authority, EHA, and the insurance body. The insurance body cannot work as a governmental insurance body all alone. You need a private-public partnership with international bodies. And that's why you will see that international private insurance companies are opening and investing in Egypt. You're talking about the top 5 names without mentioning names. All of them are investing in the new insurance system because they can cover up the insurance with the government. They can take care of what we are saying, what we are calling the upgrading of insurance services for the private service and for the public service as well.
Yes. From this important file concerning eliminating hepatitis C to another important file which is actually revolutionizing the whole world in the different segments, name it, in the field of media, in the field of health sector, in arts, whatever. You find robots today are going to be working hand in hand with humans. So how are doctors actually collaborating with robots in that respect? Are we going to see, or are we seeing actually robotics side by side in the operations room? How is the process going? What are we anticipating? How will the future be like?
Okay, most of us, we were actually in fear that they're going to replace us 100%. But
they won't.
They won't. I don't think that will happen.
We still need the flesh and blood.
Yes, and the mind thinking. And there's
of course.
Sometimes you can never mimic the human brain in terms of taking different decisions than what's obvious to be taken. And for machine learning and robotics, for example, it was actually maybe 25 years ago, since we depended heavily on robotics in terms of surgeries, but still it's human operated. So we still need the physician and the surgeon to be operating the machine. It's not autonomous, working on its own completely and taking decisions. However, we are heading there because machine learning step is already there in healthcare.
Yeah.
And currently what we are doing is artificial intelligence and autonomous thinking. We are talking about machines where you can feed with big data and they can take decisions. It was run in a very nice study in London. They made a virtual AI clinic, which is virtual and hypothetical, so there is no real patient. They wanted to test whether the AI machine can take good decision in ER, which is a very critical ward in any hospital, to take a decision of a life and death. And they took all the files of the previous 5 years and they feed it to the machine and they made the robot to take decisions. And they found that in the clinic, the virtual clinic of AI, more patients survived than the actual one happening in the UK. Oh. So the AI was a better surgeon and a better decision maker in terms of operating and in terms of diagnosing. And that's only for a 5-year data. Imagine if you are feeding the machine with 20 years of data for all country, global, worldwide, and he will take a medical decision. The precision in terms of diagnosis, the precision in terms of writing a good treatment protocol will be much, much, much accurate. However, will still depend on physicians and doctors to make the treatment that will be put in a protocol. Another aspect which is very important, I don't know whether we do have much luxury of time or not, which is the big data. The big data aspect, if you don't have data in healthcare, you don't have decisions.
Right.
We take decisions to enhance 100 million healthy lives, the presidential campaigns, doing the new insurance system based on the data. If we don't have the current situational analysis, we can never put a prediction forecast models, which is the future. The prediction forecast models from healthcare is to put all data in terms of situation analysis currently happening and try to predict the disease modeling, whether you do have more diabetes in Egypt, you do have more dyslipidemic patients, more cancer patients, what to do to eliminate certain diseases, and whether you can go for a treatment protocol or another treatment protocol, which one will be more successful. Yeah. So we're heading towards a new era. All of us, I believe, will benefit more than having any harm from artificial intelligence. It can be a good tool, not a replacement thing to our actually research and development, especially that we can save a lot of subjects in clinical trials and replace them with AI. Instead of having real subjects to try and test products, I can just do this step using AI and save a lot of human subjects in terms of clinical trials and so on till the later phase.
Yes. How are we preparing our students at the Faculty of Medicine today for this new era? How are we also preparing our coaches, I mean, training the trainers in that respect?
Okay, so if we're talking about injecting and feeding the curriculums of Faculty of Pharmacy and Pharmaceutical Science and Faculty of Medicine with artificial intelligence, it started. Not that actually significant content in our curriculum. We need more and more. However, most of the faculties are launching educational sessions on AI because if we're talking, for example, Faculty of Pharmaceutical Science, AI will heavily be the tool for organizing pharmacies, plans, and for even working in research and development, in drug design, in drug manufacturing. For physicians, it will be a great tool for diagnosis. So we need a graduated physician who can use AI in diagnosis. Of course, we need it to be physical examination as it is, but how to use the tools, how to use, for example, big data software, how to use SPS, how to use even this starting analytics is not there. You need analytics, and then you need Python for big data, you need softwares for AI. The ChatGPT is a great tool, but they need to understand how to use artificial intelligence. Even ChatGPT, it got a lot of techniques in order to yield better results and so on. So no, unfortunately, we don't have that much content in our undergrad curriculums, but I believe with a certain, what I can see in development of the curriculums in faculties in general, I can see it in the coming couple of years that it will be injected mainly in the senior years.
Yes, we can see also, Dr. Anan, a growing interest in the mobile health apps. And this is actually very trendy. This is the future.
Yes, and we are trying through mobile apps, through telemedicine, to have electronic medical records. The key thing about having mobile apps, about digitization of healthcare and about digitalization of healthcare is to have electronic medical record. Electronic medical record is your decision-making tool.
Yeah.
And unfortunately, a lot of patients, for example, imagine the scenario which happened to most of us, going to a hospital, having diagnosed with a certain disease, prescription, and then after a couple of months, they go to another hospital, another physician, and they get the new prescription. But this new physician, he doesn't know what was prescribed in the other hospital. Most of our patients will not remember or recall what was in the previous prescription. So he's actually prescribing medication. Maybe it's contraindicated with what he's already taking. Maybe it's not suitable for his chronic profile. So having a single unified patient code, electronic medical record, will help physicians take better decisions. And not only mobile apps, this is a core function for the new insurance system in Egypt that will be actually covered by 2032.
Yes, a very important goal. We're talking about the trendy applications, not only the trendy applications, but AI in general that is going to change the face of life inside hospitals. It will change the managerial, also the management of hospitals around the world.
Yeah, you can have a paperless hospital.
Paperless, yeah.
So currently, NHS in UK, they launched the Lorenzo system, which is a paperless hospital, and that's what we are trying to achieve by end of 2030, that the patient will enter a hospital just to find a booth, and just will enter his national ID. His national ID will direct him, because he already reserved and he booked, to the clinic where he would need to have his physical examination, his lab test, and so on. Then he will go to see the physician. The physician will not going to write a prescription. He will just write on his monitor what he requires to do in terms of imaging, in terms of lab. The lab will receive it electronically, and they will do it. The results will be back to the physician. Then the prescription will be at the pharmacy level, prepared in a bag with his name, just ready for collection. This is a paperless hospital. Again, if we'd like to achieve it, there's a lot of steps in terms of resources, money, in terms of IT infrastructure, in terms of human resources ready and trained to use electronic and digital platforms. We need a lot of change in our processes, and these steps are the steps our Egypt are taking from 2018 in Port Said, for example, and in Luxor and Aswan and Red Sea Governorate. Changing all the processes to be digital, standard operating procedures, flow charts, and so on. And finally, tracking outcome. You don't need, after all this, to have a worse outcome than what you had before, or a longer logistics. The main objective of having digital, of having health apps, any digital platform, is to make the life of our patients easier.
Easier, yes, definitely.
Not harder, not having longer logistics. So finally, it's a good thing. But one final warning: if you have an AI, ChatGPT, I don't urge anyone to write his symptoms and make ChatGPT to recommend the diagnosis.
Exactly. Yes, because it happens actually.
With Google, yeah.
With Google,
so imagine ChatGPT, yes.
Exactly. Yeah. Dr. Anan, before leaving you, and it was a very fruitful discussion tonight, the soaring temperatures around the world, and also with unprecedented levels in the Middle East and here in Egypt. The human health in general, how can we keep ourselves so that we won't suffer what we call a heat stroke? A bit of a tip to our viewers around the world.
So we do have many things that we need to take care during this heat couple of months, and because we have a global warming, we have a 1 degree Celsius increase in the global temperature, which is huge, by the way. We need to make sure that we are not subjected to any direct sunlight, especially from noon till 4 p.m. We need to make sure that if so, we are carrying an umbrella, wearing a hat. We we need to make sure that we are having a good breakfast. Sorry, I'm speaking fast, just the tips. A lot of water, fresh juices. Just stay away from greasy and fast food as much possible. Take much protein and vegetables during the day. And most importantly is to put sunblock and any ointment to protect against the sun. It's very important. And very important is to practice sports, by the way. So practicing, even walking during the night, will help your body temperature in the next morning to resist more from the heat itself, not to stay under the AC or any fan all the day long or all night. You need fresh air as well. But you can stay under AC or in front of a fan just during the day from, as I mentioned, from noon till 4 p.m. and then try to have some fresh air during the evening, especially that starting yesterday, we start to have a better breeze.
Yes,
during,
yes, thank God, thank God. I thank you so much for the advice, Dr. Anan, and also for the great information, always adding value.
Thank you, always a pleasure.
Thank you. Dr. Islam Anan, lecturer at Ain Shams University, thank you so much for coming.
Thank you, Mr. Ali.
And I thank you, dear viewers, for joining us. That was the Daily Debate Live with Taghreed Hussein Wednesdays. Until then, tomorrow another team.